colleagues and friends. I'm Joao Pitta from the EAO Junior Committee, and I'm here in Geneva, as you can see, with the jet d'eau just behind of me. Whereas, by the way, it's going to be the next EAO Congress already this 29, 30 September and 1st of October that you can't miss for nothing. But today I'm here to present you one more edition of the Bring the Journal to Life, an initiative from the International Journal of Prosthodontics, and summarize a very interesting paper from the IJP22 in Turkey in a very hot topic, implant-supported crowns using titanium-based abutments.
So this study is entitled Clinical, Technical and Radiological Outcomes of 182 implant-supported zirconia single crowns using titanium-based abutments, a retrospective study. So what did authors do? They went back basically to their clinical records that were collected in the university clinic between January 2016 and 2021 in order to see all the clinical and technical outcomes and complications that might have happened when they use this type of reconstruction. Here you can see the data that they collected, and in this case they only selected bone level implants with different diameters and as well used in different regions of the mouth. Zirconia crowns were used to restore these implants, and they were used in monolithic or in the veneered state, and they were all cemented extraorally to the titanium-based abutments using a resin cement. Different types of titanium bases were used with different gingival heights and as well different prosthetic abutment heights. And in the end, the patients were seen at least once a year for the recalls after the treatment, and all the complications were registered as well as radiographies. When you look at the results, we have a mean follow-up of 32 months, what is equivalent of almost 3 years, and during this period no failures at the implant level were registered. However, when you look at prosthetic level, we had two catastrophic complications, what brings us to a survival rate of 98.9%, and both of these complications, they happen in Bruxo patients. We can see here in the image one of the examples with a fracture of the titanium base close to the platform. No periimplantitis were diagnosed. However, 19 implants presented peri-implant mucositis, all in the molar areas. So as a conclusion, we can, from these results, suggest that titanium-based abutments are a good option to support zirconia single crowns. However, it should be kept in mind that this is a retrospective short review, which means that some information might be missing, as during the follow-up visits, perhaps not all the information was registered in a standardized way, as it was not planned from the beginning to answer a research question. I invite you to read the full text article in the next issue of the IJP, and I hope to see you soon.